Good evening, everyone, and welcome to the November Janis Black Warner Speaker Series. I'm Erin Raftery-Ryan, CEO of NAMI Westside Los Angeles, and I'm so glad to be here with you tonight. As we move into this season with shorter days, it's very dark out, the shifts in energy and the beginning of the holidays, I've been thinking about something I shared in our newsletter recently about non-duality, the truth that two things can exist at the same time: joy and grief, hope and uncertainty, change and steadiness, light and shadow. And this time of year brings celebration and connection, and it can also bring heaviness, reflection, and memory. And at NAMI, we're here to honor all of it. We like to create space for the complexity of being human, and we support one another through every season. So thank you for being here tonight and for being part of our community. I want to thank especially and recognize Janis Black Warner, whose vision and generosity make this speaker series possible. Janis, thank you truly for your leadership and your commitment to mental health education and advocacy. Thank you. Tonight, I'm thrilled to welcome two outstanding leaders from Easterseals Southern California, ESSC. We love an acronym around here. An organization that has been a tremendous partner in advancing compassionate, community-based mental health and disability support. We first connected with Easterseals this through our collaboration with LAPD. It was this past January during our team's 40-hour mental health intervention training. We did a CIT training. And Elizabeth, myself, and Jolissa did that training. And Jolissa really made this amazing connection because she shares her story with LAPD, and so does Easterseals. So Easterseals' presentation was so powerful. It was grounded, trauma-informed, and deeply aligned with our mission. And we knew that we wanted to continue learning from them and sharing their work with our community. So about our speakers this evening: Angela Yen, Regional Vice President, Consultation Services, Easterseals Southern California. And Angela brings more than 15 years of experience supporting individuals with developmental and behavioral health needs. At Easterseals, she oversees consultation and crisis support services, leading trauma-informed, person-centered approaches that strengthen systems of care and improve outcomes for individuals and families. So thank you, Angela, for all that you do. Her colleague, Rosario Ramos, START Program Director. So Rosario leads the START program, which supports individuals with intellectual and developmental disabilities and co-occurring behavioral health needs. She focuses on system capacity building, cross-agency collaboration, and crisis prevention to help individuals remain safely supported in their communities and reduce hospitalization and law enforcement involvement. Now, Easterseals Southern California is the leading disability services provider in our region. I mean, wow. Committed to changing the way the world defines and views disability and making profound positive differences in people's lives every day. So this evening, Angela and Rosario will share insights on enhanced care management and START, S-T-A-R-T, which stands for Systematic Therapeutic Assessment, Resource and Treatment, Crisis Prevention and Intervention. So these programs support individuals with neurodevelopment disabilities and co-occurring behavioral health needs, helping bridge critical gaps in services and strengthening systems of support. Their work emphasizes person-centered, trauma-informed care, collaboration across providers, and reducing crisis events. So with that, please join me in welcoming Angela and Rosario from Easterseals.
Thank you so much. My name is Angela. I'm the Regional Vice President of Consultation Services. Happy to be here with Rosie. And Rosie's going to project the screen for us to show off our PowerPoint presentation that we're going to follow along. We plan to speak for about 30 minutes, and we hope to save the rest of the time for Q&A to really open up for a candid discussion in terms of how we show up together to really support the population that we serve. And I love how Erin so beautifully shared, we're creating space for the complexity of being humans. And especially during this time, we're entering the holiday season. This could be a very traumatic time for a lot of the families and the people that we serve. And so we're always looking ahead, what is the best thing that we can do for the people? And so we're going to kick off. We're focusing today on the START Crisis Prevention and Intervention Program. A little bit about Easterseals is that we serve all over Southern California. We are the largest disability and autism services organization in California. We serve more than 20,000 participants daily. And so this is through our autism therapy services line, adult day services, child development, living options, as well as work first program. And we're really proud to share that we offer anything from ABA services, speech, OT, as well as really integrating and pushing in to supporting adults in adult day in various settings. We cross collaborate within our internal teams. We also go out and provide support for individuals living in the living options residential homes through ILS, SLS services, and we work very closely with other providers within the community as well, really looking at what is person-centered and how do we bring the person to the table so they have a say in their programming, in their development, in the care that they receive. Really focusing on developing their PERMA. And hopefully by the end of this talk today, you'll learn a little bit more about PERMA. Next slide. So this is just a map to show you our services throughout Southern California. We just circle LA. It is a large circle here because this is the audience that we're speaking to today. And we do offer all lines of service here. We have a residential home in the West LA region. We work with Westside Regional Center, Harbor, Lanterman, East LA Regional Center, North LA. And we work with participants kind of all over. So we're really proud and really excited that we're able to be here today and to connect with this community. So this is an infographic to show you why START and ECM, Enhanced Care Management, exist. We were brought in because we were seeing that individuals, specifically with dual diagnoses, were being bounced back and forth between the two different systems, who often work in silo. So if you have a mental health condition, let's just say you also have autism, it is very likely that the mental health provider will say, listen, you have to get your autism treated first because of the presenting challenges, vulnerabilities that we see. So they get pushed to say you have to get your ABA services started, initiated, and to reach a certain milestone before you consider mental health services, and vice versa. If you have autism, but you also have a co-occurring behavioral health condition, they're going to say, before you receive ABA services, we really feel like your behavioral challenges is at play here. And we really encourage you to go see a therapist, to see a psychiatrist, and get that managed before, we come and treat you for your autism. So what we see are individuals and families who get bounced back and forth between these two systems. And oftentimes that families don't know what to do. And so they get left behind. They fall through the crack. And so this is where we come in. Two service lines, we are not direct treatment providers. However, we do come in and we join all the systems. And we'll be able to show you the different systems that we actively engage with on a daily basis, trying to, again, paint a story for the people that we serve, and also the stories that they want to tell. So it's not just the information that we see on referral packets that follow them over the years. We really want them to get to know who this person is currently and what are their strengths. This is a really important time for us to be speaking up right now because we know autism is on the rise. And we also know that people with co-occurrences are also, it's something that we're not talking about. And these could be construed as almost invisible disability, right? You could be depressed, you could have anxiety, you could also have ADHD, but just by looking at you, we don't know that. And paired with additional vulnerabilities that we're seeing. So we wanted to call out that the stats are here to show you that the co-occurrences are here. And how do we support bridging the gap between the systems, between the providers? How do we support the families, advocate for their kids and for the self-advocates for themselves to say, this is who I am and these are the needs that I have. So bring the providers to the table and to actually help them understand what are the true needs of the person that we're servicing. So this is again a simple graphic to kind of show you some of the most commonly co-occurrences that we work and support with on a daily basis. And it is the stats are, we have stats to show you from the STAR program that we provide, as well as the Enhanced Care Management program that we provide all over Southern California. And we can say anxiety is one that we're always first considering. What's not here is trauma, and trauma may manifest in symptomologies that may look very similar to the listed diagnoses here. So how do we provide a trauma-informed approach and guide the discussion, facilitate meetings, again, to help tease out what's at play and really focus on the person that we're servicing. So this next slide will show you the change in autism, number of people being diagnosed every single year. And this is just to show you that it is very likely that somebody on the spectrum or somebody with a mental health condition will also be on the spectrum. And we see that in the day-to-day work that we do. The referrals we get from the Regional Center for START services, it is mental health driven, I would say, the presentations that we see, the instability, the unsafe behavior, occurrences of rehospitalization, re-engagement of law enforcement, and we see over 50% of our individuals have autism. That is a diagnosis that's followed them. And so we want to understand what are the current population that we're working with and what type of education, psychoeducation, communication, conversation we should be having with the stakeholders, whether it's in the school district setting, whether it's with the regional center, with their medical provider, to really help them understand, again, who the people are and what are the needs that they have. So these are some common co-occurrences that we'll see. So under neurodevelopment disorders, we have IDD, communication disorder, ASD, ADHD. And on the other side, the mental health disorders we see very commonly would be depression, anxiety, OCD, and the schizophrenia spectrum disorders, as well as the mood disorders. And so we ourselves, we are a team of interdisciplinary providers. And so we do have a medical director that we lean on to guide us in conversations. So we can then share this information we learn and share with the provider that's actually treating the person who is servicing the person. This is, again, to increase the knowledge, to increase the discussion, and to shed light on what are the symptomologies and what do we do as a whole system to really be able to work together and to remove the silos and to ensure continuity and consistency of care that to support the person to reach safety and stability.
Hi, everybody. Good evening. My name is Rosie. I'm going to go ahead and move into talking a little bit more specifically about our START program here. As was mentioned, I am the START program director here at Easterseals. And START, as Erin mentioned, starts for Systemic Therapeutic Assessment Resources and Treatment. It is an evidence-based community crisis prevention and intervention service model for individuals 6 and over. We service individuals up until lifetime. It focuses on the community with intellectual and developmental disabilities alongside a co-occurring mental health need. The START model in particular, it is very, very person-centered, and it really focuses on employing those positive psychology approaches. And we really, again, as my colleague mentioned, we are not a direct service provider, but we really strive to build the capacity across different systems to help meet the needs of these individuals. This is just a current map of the national START locations as of March of 2025. The START program was founded in New Hampshire, but it currently serves over 34 different states in the nation. The dark blue is a state where a certified START program has been established, and then other colors are different. Just either working with a START program or in the works of creating one. So we're pretty widespread across the nation now. So it was originally founded, as I mentioned, at the University of New Hampshire. And since 2011, there has been a National Center for Start Services that helps provide training, evaluation, and certification to START programs and resource centers. So the START program, again, like as I mentioned, has worked across 34 different states. California currently runs a total of 18 programs from Northern California, Greater Sacramento and Bay areas, down to Southern California. And currently, there are six START programs with the SoCal regional centers. A little bit about our program here at Easterseals. We did launch back in August of 2022, and as of April 2025 this year, we are a certified START program. So meaning, under the guidance of the National Center of the START program, we've received a little bit less guidance now. We've demonstrated that we are executing the model with fidelity, and we just are, really running it as it's meant to be. So we're really, really proud to be a certified program now. And our team here today currently includes one clinical director, one program director, myself, one associate program director, I think she's in our audience today, one clinical team lead, six START coordinators, one therapeutic coaching lead, and two therapeutic coaches. And this coaching team really helps enhance the work of our coordinators that are kind of more so kind of a little bit like case managers. Our team backgrounds, we have a variety of different backgrounds. So we do have our clinical director with a PhD in psychology. A few of us are BCBA, various ABA providers in the past, child protective services backgrounds, amongst other things. So currently the START program here at Easterseals serves the East LA Regional Center only. We are the vendor provider for the START program with East LA Regional Center, and they have just been a wonderful partner to us. We really believe that their mission statement, their values, just really aligns with the Easterseals values of really supporting a community with different people with different disabilities and vulnerabilities. And they just have been very fundamental to, I think, the growth of our program and our program becoming certified. And they've just been a wonderful partner. And we're very lucky actually because this regional center just has been really great to us and a great partner. This is kind of the service area. So this is the catchment area for East LA Regional Center. So this is the service area for the START program here at Easterseals. So we'll service people in bits and parts of Pasadena, East Los Angeles, Alhambra, Montebello, parts of Pico, Rivera, Whittier, all the way down to like La Mirada, La Habra Heights. I was just down there in La Mirada today. So a little bit about the START philosophy and just guiding principles for the START program. We do employ, as I mentioned, a lot of positive psychology concepts, and one of them is Perma Plus. And this is just absolutely my favorite part of the program because we really believe that this concept can just be applied to anybody. So disability or no, or not, right? If someone is able to engage in their PERMA every single day, we are less likely to experience crisis situations. And PERMA, like we said, we love acronyms also. PERMA stands for positive emotions, engagement, relationships, meaning, accomplishment, and the plus is just overall vitality. So our STAR coordinators help the different systems of support in helping identifying for each individual that we serve what brings them their PERMA plus, what brings them positive emotions, what brings them engagement. And then this is very just person-centered, very individualized, right? Because whatever brings me positive emotion is not necessarily something that's going to bring someone else a positive emotion. But we really, really like to focus in on this and help the systems of support identify this for the person and help them support the person in engaging and accessing these different things on their daily basis. So whether it's, if it's a positive emotion, if it's brought them or emotions, positive emotions are brought them going out for a walk at the park, or engagement is just, going to the gym every day, or relationships. What do their relationships look like? Do they have positive relationships in their lives? So this is a big focus for our team and for the participants that we serve. We really, really hone in and focus on this, I think, right away from our intake process to help identify this for the person and then help strengthen that across the time that we help serve the person. Another START philosophy that's also taken from positive psychology is just a biopsychosocial model. So we also want to understand the person as a whole. And as Angela mentioned, sometimes these individuals are just kind of bounced back from different providers and different diagnoses that are just, a person may receive as a label. And it just things might be blamed on one thing or another, but we're really wanting to see and look at the different factors within the biological concept of it, the psychological, the social. How are these different things within their lives impacting them? A few different examples and systems that we work with and systems within California. So when I mention a system of support, a unit, whatever the person is kind of engaged in or is related to. So they might be consumer of the regional center. They might attend school, so they might still be underage and have a school district. That in itself is a system that we want to join, that we want to support in supporting the person. Medical providers is a big one as well. That goes back to the biopsychosocial model. So we want to make sure that we're helping support the different systems of support. So whether it's the family as well or residential providers, help the person access the right type of medical care. Therapists as well is super important. As I mentioned again, START is heavily focused on positive psychology, mental health. So we want to make sure that people are being able to access their mental health services. Also, adult day programs if people are part of it, other crisis community supporters or providers, again, residential providers, recreational providers. Family is a big one because we call those as well like a natural support. And sometimes these can be very, very important for people. Any kind of first responders or legal involvement as well. This illustration here I just like to include because it kind of breaks down how someone would become part of the START program. So typically, the START consumer or participant may be experiencing prolonged 2-to-1 treatment, may be experiencing repeated hospitalizations, has this co-occurring mental health or ID diagnosis, may have history of trauma, may be at risk of losing residential placement, and maybe just a high utilization of emergency services. So typically when that is occurring, a service coordinator of the regional center will, see this individual kind of experience these repeated crisis situations or events, and will make a referral to the START program, and that's where we start our work. So more specifically, what START services includes, someone who is referred and qualifies for the START programs becomes a START participant. We'll have a START coordinator assigned to them. So this is kind of like their case manager. But as I mentioned, we don't do any direct work. We start right off the bat. The only kind of direct service we really do provide is the access to a crisis line. So within the very first day, within the first 3 days, we're going out there, we're meeting the person, we're meeting their primary system of support, whether it's caregivers, residential staff, or the family itself. And we're creating a provisional crisis plan in the interim, providing their crisis number that they'll have access to, and only START participants have access to. And this is a 24/7 crisis line. The intake process, where we conduct various different assessments that we just kind of want to gather as much information as we can about the person, and that's including a PERMA assessment. So wanting to know the strengths of the person, what what brings them PERMA. And then just recent stressors or anything like that, challenges. This may be conducted across 3 to 4 initial meetings with the primary system of support. Then eventually, within like the first 3 months, 45 days or so, we are creating what's called a cross-system crisis prevention intervention plan. CSDPAP is the acronym. And this is really the heart and soul of our work. It is an extensive plan that really illustrates the person as a whole. It illustrates maybe their diagnoses, any kind of medications, any kind of vulnerabilities, but also their strengths and what do they like and what ways to build rapport. How do they communicate? What's the best way to communicate with them? Um, Various different strategies and information that we're learning from the different systems already in place. So we don't like to say that we create this plan, we just kind of author it based on the information that we're gathering from the different systems of support. It's really meant to be a plan that's created in collaboration with the existing systems. So we're not reinventing the wheel, we're just gathering the information and especially the positive information about the person. And then we're also creating within this plan different levels of crisis situations and how that looks for the person. Because again, also we're striving for stability for the person. And typically when we're coming in and we're seeing instability, it might be due to a lack of communication or engagement from the systems. There just might be something or a gap that's kind of there, or maybe there's resources that are missing. But this plan is really meant to help bridge all those systems together, bring them together and understanding the person, come to an agreement of how to best support the person, especially during crisis situations. And as I mentioned, there's three different levels where the first stage, we're hoping that the system of support can really help support the system or the person through the crisis situation. At a level two, then that's typically where we're probably going to come out in person and help support. And also level three, we're coming out in person, but there might be a need for maybe emergency services. We do not replace any current or existing system. So if a person is in need of higher level care or emergency services, we do encourage the utilization of that if that's where they're at in their crisis. But we will always show up regardless to help bridge communication, help support if, for example, law enforcement needs to be involved or anything like that. Also, a START plan is part of our services, and this is just kind of a current assessment of the person and their system, where they're at, what their mental health stability looks like, and then also details kind of a quarterly report for us and our projected services within a quarter. This is just kind of an illustration of what I kind of went over, just the lifeline of our START services. The START program is meant to be pretty temporary. We like to aim for about 18 months or so. As I mentioned, our kind of overarching goal is for stability for the person, more access to perma and positive things in their life, but also bridging communication amongst the different systems of support. So once we receive the referral, we conduct an intake. We gather all that information. Our treatment again looks more like, utilizing the crisis line, implementing that cross-system crisis prevention plan, our START plan, and things like that. Maybe referral to resources, coordination of care, collaborating with the different systems of support. Then once we're seeing maybe stability or just a greater sense of stability, we also understand that sometimes people with these dual diagnoses may always have a crisis or two, may always experience challenges. But if we can come in and really help build the capacity of the systems to help them support the person through such situations if and when they occur, and we feel that those systems of support have reached a point where they feel confident and they feel at ease and they feel that they are equipped to respond to the person if and when they do have a crisis, then our work is done. So then we plan for a transition and we plan for about, kind of this graduation, quote unquote. And we make sure that all the resources are in place, including community crisis responders as well. We work with a great program within the ELARG catchment areas, CRP, that services all the consumers for ELARG. So we kind of hand that over back to them, and they have, most of our participants will have that as a resource. And then we do kind of just a graduation, and we do follow-ups and check-ins within 1 month and 3 months. And if ever the person is in need of crisis support or our services again, then services can be reinitiated as well. And here are the programs, the START programs across Southern California. So as I mentioned, Easterseals is a vendor for the START program for the East LA Regional Center only currently. But the START program is available across other vendors and other companies. So for example, Tri-Counties, Harbor, and Landsherman Regional Center provide this START program through the organization YAI. That is also a great partner to us, and we've done a lot of work with them, and the LAPD as well. San Diego Regional Center and South Central Regional Center also have a START program, and the Westside Regional Center program, or Westside Regional Center, is currently launching their START program. So that one is very, very soon to come. And that's it for the START program. Any questions? Not sure if there's anything in the chat. You can also put it in the chat.
Thank you so much, Rosie. That was amazing. Perhaps we will kind of come back to our Hollywood squares for a moment. That was a wonderful presentation. And for me, I learned so much more about what Easterseals does and the amazing work that you do. Um, there we are. There's our Hollywood squares. Um, and I was really taken with the concept of PERMA. And that how we all need more PERMA in our life. And I love that you said, what brings you PERMA? And I love that you said the plus is just overall vitality. Um, that was just wonderful as far as just the overall concept of the work that you do and trying to create overall vitality. So, but let's open it up to our community and hear people's thoughts and if they have any questions. Jefferson.
I want to echo what you said, Aaron. This has been a fabulous presentation. Thank you, Angela and Rosario. So, oops, I was getting shy there for a second, covering myself up. Yeah, I do have a few questions, and I do not want to bogart the whole meeting, but I will start with a couple. And Aaron, you'll stop me if I'm overstepping here. How did you? So your the Easterseals Start program is specific only, as far as you guys are concerned, to East LA. And then you listed a few other opportunities in different areas, but it's very specific as far as the area that you're targeting. Is that correct?
Yes, but the START program, which is just the START model, kind of what I reviewed, everything about, the program itself, Perma Plus, the cross-system crisis prevention plan, that is a national model. It's a national program. So it is available at those other regional centers that I listed. And there's hopefully more to come. I think the goal for DDS is to have the START program at all the regional centers in California sometime soon.
Okay, yes, I understand that. So I work specifically at UCLA, and a lot of times their management team, when they're about to be released, they're looking at all the resources available to them. It may or may not include this because they may not live in the areas that are covered at this point. If you don't live in that area, can you migrate to that area? I mean, there's people sometimes who say in our support groups, I don't have housing. So that's negotiable, I guess. So um, just curious to know. So it's specific if they only live in an area that is offering START, that's the only way that they can access START, whether it's through you or these other entities. Is that correct?
Yeah. So first thing that they have to be is they have to be a quote unquote consumer or recipient of the regional center. So they have to qualify for that. And then that's step one. Step two, then we look at, do you live within the catchment area of the regional center that offers START prevention intervention services? So give you an example. We have served participants who's lived in ELARC catchment area, literally moved across the street, the same exact street, moved across the street, changed the regional center. And that regional center that they moved to does not currently offer START services. So what we were able to do is negotiate with ELARC to look at transition planning, to look at what are the other existing systems that can be offered by that incoming regional center to help with the continuity of care, to share the plans, to say this is what's working well for this person, what's stabilizing the person and the family. And this is, again, what we would recommend for considerations moving forward to continue to support this person's overall wellness.
Thank you, Angela. Yeah, I get the idea that once they're in with you guys, they can access this support, which I think sounds fantastic. How you mentioned, and maybe you already talked about this, I guess I just need a reminder. How do you qualify? Is it because you have a physical condition? What defines qualifying?
Yeah, that's another great question. What we could do is drop a resource in here for you too. So you have the eligibility for regional center consideration, intellectual developmental disability. You could have epilepsy, any sort of neurodevelopmental delay would be considered. And there are some other criteria that is very specific. So at any age, you can say, listen, I have this condition. I would like to be evaluated. I would like to apply for regional center services. And you would just say, I live in this zip code. This is my regional center. Let me call them and to see what is the process for the intake process to start. Once you start the intake process, they will want to assess, right, and make sure they review all the documents. You'll be assigned, the person with the family will be assigned an intake coordinator from that regional center, and they will walk the family through all the process that they need to go through. And this is information that can be found on DDS website, as well as any of the regional center that the person lives in that falls within that catchment area. And we can drop the links here for the
That would be
audience.
great. And so Angela, you mentioned families. So one of the cool things that I love about what NAMI does is they offer family support and training for families with loved ones. Is that part of what you offer as well?
Yeah, so a big part of what we do for STAR is really the community education piece. And so part of what we want to do is to spread the word that not that the prevalence is increasing with co-occurrences, but it's really to educate the community and the families in terms of if you have somebody with these needs, right? This is just a presenting needs, the observable behaviors that we can see. But what are the underlying cause to this? So I'll give you another example. One of the consults that we did just this morning, actually, with our medical director, this man, he's in his 30s, he's a conserved adult, right? Repeated hospitalization to psych hospital, to the ER because of medical issues as well as psychiatric symptoms. And mom is an older woman needing support. So when we saw the referral come in, we asked all the biopsychosocial questions. So first thing we look at is he has diabetes 1, and he also has gone to the ER because of his blood sugar level. And we look at the list of medication he has and to look at what has led and contributed based on the information we have to the repeated hospitalization. Who are the overseeing psychiatrists? Does he have an endocrinologist who's overseeing his care? Do we see different prescribers for medication? Why is that? And oftentimes, and we've been servicing for this person for 2 weeks now, and we're learning that oftentimes there's a lot of mistrust with the system or just information that they don't know even how to ask the question or who to ask the question. Sometimes the family, mom just say, I can't even get a person on the phone to guide me through the process. So this is where STAR, this is where ECM comes in to really kind of, we put all the information in and we synthesize the information in a manner that makes sense to the caregiver, in a manner that makes sense to the providers, and to ask the questions that the family wants to ask, to give them kind of a lane, right? To say, here, I'm here to tell you my child's story. These are the struggles I've always had. These are the reasons why I don't trust the system, right? So giving them a reason, a voice. Again, we walk alongside the families that we work with, and we say, crisis prevention work, right? It takes time, right? And we're probably the 20th provider that they've seen, who's saying, I'm going to be here to help you, right? And then what is their experience? So we get that.
Yeah.
So we do the best that we can. We join the family and we move at their pace. And that's really important.
That's really powerful. Thank you for that answer. And then my last question is, you had mentioned at the get-go that autism is on the rise. Now, I don't think I'm alone when I say we've been deluged with misinformation about that, not the least of which is Mr. Kennedy. So, what, in your view, is this attributed to, do you think? I mean, how do we, two-part question, I guess. What is that? And then how do we combat misinformation in that regard?
Well, that's a big question. And I agree with you. There's a lot of resources, information out there. So what we will also do is drop a link for Easterseals to kind of show you how does Easterseals define ASD, kind of the information we gather from our Chief Clinical Officer, Dr. Paula Pompa-Craven. She's done some just kind of information sharing on this topic specifically based on the more recent information that's come out. So we wanted to make sure that Easterseals provides the information that we believe that we stand by. And so there's a lot of reasons, right, why we see the numbers change. And I think one of the most important things is that if you have been tracking kind of autism, or just people with disabilities, there's different ways of describing it, right? There's people with a disability, or I am a person with this diagnosis, right? Or I'm an autistic individual, I'm somebody with ASD. So different ways of just talking about it now. And I think people are a little bit more open to sharing this. I think there's increased awareness, first of all. There's a change in different DSM, right, versions over time. And so I think just increasing in awareness, as well as the medical community is also moving along to do a better job, or a refined job to kind of redefine, I guess, the terms based on the symptomology that we see. So I think that's important. There are many different factors to consider, but I see that Millie dropped the link here already, and this is a great library of resources for you to dive into.
Wait. So you're saying it's not because I take Tylenol?
Listen, I feel like that has recently been debunked, though, in the last 48 hours.
We can always count for Jefferson on some comedic relief. So thank you, Jefferson, for your questions and the comedy, the levity, we should say. And Janice, I saw that your hand was up.
So I've been hearing the regional center every single day. The regional center, could you explain what it is, and do they pay for housing for these people who are suffering from these disabilities? And is it only autism? That's like the main thing I hear is autism, because my loved one has schizophrenia and he lives in a home, and there's a lot of new young people coming in with autism, and it's harder for my son to accept, even though he accepts everybody's illness, whatever they're going through. It's just the regional center is something. I have a relative whose grandson lives with them, and the regional center comes to their home and they help with the grandson. He must be 19. He has autism. But I don't understand the regional center, and I wonder if Easterseals would help my loved one who has schizophrenia, because it's really hard. I was looking at homes in Orange County yesterday, Mission Viejo, whatnot, but it was not the right fit. Our audience tonight is mainly San Fernando Valley, West Los Angeles, the people that I know that need help. You're talking about East Los Angeles and other areas. But my main question is, what is the regional center? Who pays for services? Because my relative said the regional center helps pay for care for her grandson who's 19. I don't understand the regional center because I've heard this name every single day. And if you could explain to me, ladies, what is the regional center? Does the government fund it? Is it a grant? What is it?
Yeah, so I just dropped the link. Excuse me, I have a cough. Um, there's 21 regional centers in California, and it is a state governed. DDS governs all 21 regional centers. So they have to, everything is open data source essentially, right? They want to know where the money is going. And you can go on each West Side Regional Center, North LA Regional Center, probably some South Central. You can really take a look at the different services offered and eligibility. Once you are a qualified consumer of the regional center, let's say you became eligible in West Side and you decide to move later, to Orange County, you will remain as a regional center consumer. You will transition from one regional center to the next. And so earlier what we had talked about is, how do you qualify for regional center services? So there's different criteria. I know Millie dropped one, that's East LA Regional Center. That is just the information from East LA, but it's really similar. Again, you will find for, whether it's West Side or North LA in terms of eligibility because it's standardized across. So in terms of individuals who may or may not qualify for the regional center and they're looking for housing, right, that becomes really challenging. And for START is a different story because START is funded by the regional center, right? And we are data driven and we are the National Center for START Services. We have data that we put on a monthly basis, quarterly basis, and we send it to DDS to drive the discussion to see the efficacy of the program, right? Are we preventing crisis? How are we servicing them? The length of service? How quickly do we respond? Now, for the other line that we didn't really touch upon today, that Erin initially had introduced is enhanced care management services, also offered by Easterseals and offered by other providers through Medi-Cal, actually. But for Easterseals, our lens is a little different, and it's really similar to everything that Rosie presented. Biopsychosocial based, PERMA, really trauma informed, and again, we're offering an interdisciplinary model. We see the struggle that you're talking about, right? We walk alongside families. They say, we're not a regional center consumer. We then have maybe more limited resources and maybe some people who do qualify. So what do we do, right? And so again, we lean into other resources that's available. Department of Mental Health is a big one that we lean on. DOR is also a big one that we lean on. And we look at the Medi-Cal, the insurance funding source as well, right? And look at, again, if somebody has been denied, let's say housing, due to specific challenges, what do we need to do to address to prevent that from happening again? And so if it has to do with financial considerations, right? How do we look at existing resources that they can potentially tap into for some financial support? And so we do at Easterseals, we also have a RISE and an IDA program, and we do offer actually linkage to some of these community-wide resources all over Southern California, including the population, the families who will listen to this recording later on, right? Specific to the San Fernando Valley on the west side. And so we have a list of resources that's also available for the families in specific regions. And so we're happy to share that information also from Easterseals perspective too. But unfortunately, like what you're saying, to have access to regional center services, they will help somebody find appropriate housing situation if that is what's appropriate for the person, right? And if the person needs that. What we do want always to see is that the individual can be close to their natural support system, right? If that's possible, and if that's a healthy relationship we want to build upon and to draw upon any other additional resources that we can offer. So the different kind of systems that Rosie had mentioned earlier, whether it's recreational services, or you can have personal assistance to, lend relief to a mother of 4 children, all with varying needs of age range, and the person still has to work. So where does this person get time? So we will look at how to link them to appropriate resources, who are the case manager who can help advocate for them, things like that. But the systems are very siloed. Again, they look at what are your presenting needs, and that really kind of dictates who gets to fund, the services that they're looking for. But somebody being unhoused, a housing crisis, that's something we see really across board. Even somebody who is a regional center consumer, there may not still be kind of the quote unquote appropriate housing situation that we're looking for right away. Again, because maybe the staff or the level of the home, they feel unequipped to support somebody with these presenting challenges. So that's kind of where we come in and we look at how do we help them reach stability, and what does it mean to qualify for a residential facility that allows them to live their best life, right? And so what are the resources that need to be in place to co-occur with all these considerations at the same time?
And finding a long-term program is
Yes.
really hard. I was
Yeah.
looking at a program yesterday. I just Googled it. It was in Orange County, and I went and toured it. I don't think any human being who has any type of disability could live in this program. It was so 6 homes for women, 6 homes for men, and then they go to an IOP for very long hours, and it was just would have cluttered my head to
Mm.
for anybody who has an illness to go to this program like who's because most of the people that I'm in the circle with my loved one, they're very ill. They're too ill. Uh, it's hard to function. They can't have a job. They don't finish what they start. So you don't have to have autism. There's so many diagnoses. But and I heard you say something at the beginning about jobs. Do you help them find jobs?
Yeah. So at Easterseals, one of the line of service we offer is Work First. We have customized work employment services, and it's a really wonderful resource that they go and observe the person in their natural setting. What we think, would be something that the person would be good at may actually not be the outcome that they find, because it's really through kind of the details, their what makes them smile, what motivates them, right? Some of the stories that the families tell. It's really, really neat. And every time we collaborate with our customized employment services, we hear their presentation. We're like, how do we replicate this, so more people can have access to this lovely resource, and to the people who come out and to assess and to support the matching of the customized employment that we're looking at. I think finding jobs in addition to that too, is a conversation that we encourage our families to start having early on. We don't start having transitional planning to have these conversations wait until they're 18 over. We start having these conversations as early as 14 years old, right? When individuals have challenges, we want to make sure that they're brought to the table, whether it's through the IEP, the IPP process, or even just meeting with any of the caseworkers, right? To really look at what does it mean to you to hold a job later on? How do you be independent? What are some foundational skills that you need to have, and to start building on those skills early on? And one thing I wanted to address, Janice, you had talked about are the mental health symptoms, right? They're so sick that they can't hold a job. And so before we even talk about, finding a job, we're really looking at, again, how do they wake up in the morning? Can they get up and follow the 10 steps that they need to get dressed and leave the door, right? Leave the house. Do they feed themselves? What is their kind of vitality, the plus that we're talking about, right? Their nutrition, their sleep hygiene, medication intake, medication adherence to that. All of these are worth considering, because without some of these kind of the core, the SCOH factors that we're talking about, it's going to be really hard to look at the next step of life planning for the people, that really strive to reach for that independence too.
And my last question, how do you meet with this group of people? Do you have a home in Los Angeles where Easterseals, do they have a building? Do they come to you? Or do you physically go to their homes? Or is it on Zoom? How do you help them personally?
Yeah. So for the different families that we serve, we Rosie, here's us. We talk about this all the time. We have to go see that. We want to meet the family. We want to see the environment that they're in, right? Because that's where they feel most comfortable. So we always join the family where they're at. We will go to, a doctor's appointment with them in person if they'll allow us to, if it's appropriate. We will go to their school for a meeting if that's needed. We'll go to the gym with them if that's what they want us to do, right? We've gone shopping with them at Ross before and just kind of walk around too. So wherever it is, because what we want is to be able to gather information to learn who they are and to look at, again, how do we engage in safety planning and also stability planning? And what are the systems that needs to be involved to also engage in that same conversation with us too? So we'll go to them. We'll have meetings at different kind of provider buildings if they need to, and we'll have it over Zoom or Teams as well. And Easterseals will have different locations, office locations all over Southern California. So we will also host meetings in our office locations if needed. And so it depends on the family's preference, right? Some families don't want meetings in their homes, so they prefer to go out to an office, and we will offer that space.
It's interesting. How many people are employed in each district who work with the START program?
So for our East LA Regional Center START team, one of the slides that Rosie has shared is that we currently have a staff count about 11, I think 10 or 11. And the way that these positions are set up, intended, kind of follows the NCSS model, right? You have to have these core positions, and every position has a role that they play. And so again, we work as a team. You'll find, many times there's more than one person out in the field supporting the clinician, developing their clinical conceptualization. What is their working hypothesis of what's going on? What are the next steps that they need to engage in? So for us, we have a team of 11 people currently.
Thank you.
Yes.
Janis, thank you so much for those questions. I think we're all really curious. I have a couple of questions, but Elizabeth, you have been waiting so patiently. I see your hand, so go ahead.
Thank you, Erin. Yeah, and thank you. This has been so informative, and these questions are so great. One thing that I wrote down during your presentation, the stats really stood out to me that I think it was like 78% of individuals with autism live with one mental health condition, and I think it's like half live with two. And I was wondering and thinking about us here at NAMI Westside LA, and I think sometimes in the mental health space, mental health conditions and autism might be seen in separate categories. And I'm wondering how, as a part of NAMI, we can be more inclusive to autistic individuals, and what would that look like to be more collaborative in like mental health spaces with orgs like yours?
I love that question, Elizabeth, if I can, Angela, because that's something that we're always striving to do. So my role as a START program director is really to help gauge that gap and make those linkages with these community resources. So many times, our START coordinators are referring either family members or caregivers of our participants to groups like NAMI. We've also referred them to the peer support groups like that NAMI has. So, just doing presentations like this, community education, and continuing to reach out to your organization is just super helpful. I myself will have maybe like monthly check-ins, for example, with the Autism Society of Los Angeles. And we also discuss ways in which we can help bridge gaps within the community and how we can spread word about the different resources. So how can I spread the word about, start as a resource to that community that they have? And then, in term two, or likewise, whatever events they may have or resources they may have, they'll share with us. But something I think that that's been really great is just that, yeah, that community partnership, that linkage, if we can continue to meet within our organizations at a larger scale too, just kind of tap into you as a resource and help us understand how our participants can access your resources. So, we again, the individuals with these kind of dual diagnoses, a lot of times providers, even the regional center might say, oh, that's the autism, that's the attention seeking. No, this person has maybe a diagnosis of bipolar and there's some serious suicide ideality happening. Can we utilize maybe a peer support group? Can we use a helpline? And how do we tap into that resource, and how can we bridge, this gap as systems as a whole, and understand how your system works, how your organization provides these services, and are the providers, are the services knowledgeable on how to provide services and support for people with these dual diagnoses. So just keeping this conversation going, I think, amongst these providers, amongst our systems, I think is super important.
I agree. Thank you so much. I really appreciate it.
Yeah.
Thank you for that question, Elizabeth. That was definitely something that stood out to me as well, those statistics and also the first slide that you showed, Rosie, or one of the first was it was like this big abyss. And on this side, it was, mental health conditions. And on this side, it was like behavioral health conditions. And you were trying to bridge the gap. And I think that, with our community, there's so many co-occurring and dual diagnosis. I also think too, as just advocates right now, as a state, there's a big transition as far as Proposition 1 is concerned, and a lot of the funding for mental health services and behavioral health services, there's a big discussion about happening right now about where the funding is coming from and how to categorize sometimes and shift. So I think this conversation comes at a very important time to make sure that we are doing community education and that also supporting our caregivers. I really liked that question earlier, Jefferson, that you said, do you support the families as well? Because that's so important. So it's great to hear that there is support too for the caregivers. Yeah. Cynthia, I see your hand up.
Yes, thank you. We're just learning, all of us, and I think it's wonderful with the community that we could share with. I answer a lot of phone calls, and I do get phone calls all the time regarding the regional center and how close it is with autism and bipolar. So I like to know what I'm saying. You could be ADHD, autism, neurodiversion. But if you have more mental illness, serious mental illness, will you help us? And usually you have to start at age 3 to get into the regional center. What about people that are older?
So I want to make sure I'm hearing you correctly. So the regional center, if they will assess individuals of all ages, right? And so if you go in at a later age, they just want to make sure that this person has had this challenge, these vulnerabilities at an early onset of age, right? So you just need to provide some documentation to support that discussion, essentially. But again, once you are a consumer of the regional center, you're a consumer of the regional center for life. And the qualifying eligibility criteria is really saying that these are the diagnoses that, will stay with the person for a lifetime, right? So if you have autism age 3 versus you get a diagnosis at age, let's say 15, we're not saying you just got autism age 15, right? We're saying that this is something that you have always had, but maybe you just didn't know you have the right access to resources. We believe it or not, we work with parents who says we don't want an autism diagnosis following my child's plan, right? And so they've worked with existing systems to make sure some of these diagnoses are actually not listed. And I think, again, there's different examples, different people and families that we work with. So there's always different reasons. Now, I think we work with people with many different challenges, many diagnoses. We'll find sometimes is that diagnoses are added on maybe after hospitalization, right? Because then new medications are added. So when we get involved, when START team, ECM team get involved, and I can only speak for our team, we really look at, we review the records, right? We say, this person's pretend 35 years old, the diagnosis started adding on, let's say maybe around age 18. What happened during that time? Who gave the diagnosis? What kind of all happened during that time period? And continue to paint a picture. And so when we get involved, we're looking at the presenting symptoms. We don't let the diagnosis to drive the discussion, right? Because then that's all really just paper trail. What we really want to understand is what are the presenting strength and vulnerabilities of the person that we're servicing to say, does this person really have autism and bipolar and schizoaffective disorder and all these things, right? Does this person really need 5 different types of antipsychotic medication that this person is receiving, right? Is this person living his or her best life? And so we really dissect all that information. Again, we're not we don't give the diagnoses, right? That's not our job. And we always lean on the experts in the field to do their expert job. Yes, but what we do want to do is to say we're meeting the person where they're at in this moment in time, right? Maybe a week ago that person was hospitalized, right? But right now the person is stable, the person has been discharged. These are the current presentation, these are the medication that's working well. Let's say that's the case, right? And then we kind of peel the onions layer by layer to understand, again, what does a person need to live their best life? And then we'll start looking at the records that has followed this person. Some of the things that we do to help families is when we're looking at residential placement considerations, right? If you appear a certain way on paper, sometimes you're immediately rejected, right? Because we can serve a person who is nonverbal. We can serve a person with these level of behavior challenges. But what we do want to make sure happens that what the referral package states is representative of the person's current needs, right? So if the current person has this need and we're considering different services, then can your service be offered to meet the person's needs? Again, so the person can live their best life.
I have a question.
Thank you.
Go ahead, Janis.
Okay, in relation to Cynthia's second part of her question, your mission statement, is it primarily for autism? Because our community with NAMI,
Yes.
it could be borderline, bipolar, schizophrenia. We have so many different diagnoses, but what I'm hearing is 90% plus seems like this is just autism is your primarily the illness that you serve. So
So
how do
we
you,
serve everybody with all disabilities, right? But because Rosie and I, we belong in the autism services line. And so this is really kind of our bread and butter, let's say, right? And this is but with STAR, the people that we serve, they don't have to have an autism diagnosis to qualify for STAR services. But we're just saying that the statistic that we have on the list of population that we serve, 50% or more of the people have an ASD diagnosis. We, at Easterseals, we do serve people with all varying disabilities. And I also want to say that we are also launching our new behavioral health department as well at Easterseals. So that's been something our chief clinical officer has been really just honing in on, invested in, to make sure that we're creating systems of support to really address the behavioral health needs and the gaps that we're seeing within our community too. So that is something that is going to be coming soon to you from Easterseals. But again, we serve all people with varying disabilities. It doesn't have to be just autism.
good job, Erin. I see the mission statement here. Thank you. Thank you. That explains a little better. Thank you.
That's great. And the work program is also in the chat too, Janis, that you asked about earlier, and that Angela was talking about the Easterseals Work First program. So that's
How do you copy
if
the
you kind of hover,
uh,
over, there's like three dots. You can click the three dots and press copy. Or you can just click it and it will bring you to that site. And then you can just kind of have that tab open on your computer.
Okay, thank you.
Yep, absolutely. Um, Thank you, Angela. And Rosie, both of you have kind of talked about um, some things that are coming down the pipeline that may be more aligned with our specific NAMI Westside community. And it's great to understand what those are. And then again, just the original connection where we met your team with LAPD, right? And kind of sharing these stories. And so I love that you are doing that community education, just like NAMI is, to make sure that people are aware. I believe you mentioned that there might be a West Side Regional Center opening. Did I hear that correctly?
Westside Regional Center is launching Star, and they've chosen a provider, a vendor already. I just don't have the name off the top of my head for the provider for Star services. So
Okay.
I'm thinking that they're launching 2026. So
Sure.
yeah,
Well, just maybe you could keep us posted on that. That would be so wonderful.
absolutely.
Like Elizabeth's question to like, how do we kind of keep merging this
Yes.
information and sharing information so we make sure our community knows the great work that you do. And by the way, great job with a partnership with the NFL. I'm watching, my husband's a big Bears fan, and we were watching football, or he was really watching football on Sunday. And I was doing my agenda for Monday. But I saw a commercial for Easter seals, and I thought, oh my gosh, that's so great. I'm so proud of you guys for having that branding and marketing. It was really, really wonderful to see your name on such a high profile.
Thank you. I will share that with our marketing team. I'm sure they're going to be happy to hear about that. But yeah, we definitely want to. I think this our disability campaign, that disability is not a dirty word. It's really about empowering individuals. And again, make sure that they have a voice, they have a stage to also be able to share all their strength and all their love and what brings them perma. So yes,
Love that. What brings them perma. And also knowing that coming down the pipeline is like your behavioral health kind of
absolutely.
department. And
Yep.
again, I think that's great, with this new transition happening in the state of California. And I'm sure, just with the political climate right now, I think it's wonderful that that's going to be a little bit more specific in alignment with NAMI's mission as well. But the statistics are great too, to understand that a lot of these are co-occurring, um, that our communities overlap a lot, right? Yeah. Wonderful. Any other questions or comments? Cynthia.
And where is the behavioral health clinic that you're thinking of opening up? And in what area?
That's a great question. It is going to be in Irvine. We are launching our Center of Excellence. Um, as you know, how construction time works, and we're anticipating 2026. Fingers crossed.
Thank you.
Yes.
Cynthia, I love that you asked. I mean, she always gets right to the bones of it. It's great.
Always love that.
Yes. She is boots on the ground with our outreach. And so perfect person for that, her and Garrett. Um, Anyone else have any comments or questions before we say our farewells and thank yous to our Easter Seal colleagues?
And I want to say thank you, Erin. This is so out of the box. Growing up in Los Angeles, seeing what Easter seals is, I didn't understand what you really do. And trying to help our NAMI community and speaking tonight, we're grateful because you're not just going to touch us. It's going to go to a broader group of people watching this. And thank you, Erin, for thinking this is very out of the box, but it's also necessary because, as I said, I've been hearing about the regional center and I was shocked. I didn't know what you really did. So thank you.
Mm. Thank you, Janice, for creating the space, for us to have these conversations. We really appreciate you and your dedication throughout the years. Um, so thank you. And I want to give a shout out to Jolissa, our colleague who's not here. She was really the one that made the connection, I think, maybe with you, Rosie, at the LAPD. So we did our training in January, Elizabeth, myself, and Jolissa, and it was 40 hours. We went the whole week and we trained with LAPD. It was kind of a transformational life experience for me, but it was amazing for many different organizations to come in and share their knowledge with law enforcement. So to really teach them, de-escalation skills. So when there is a crisis, that they can identify what a person living with autism may be experiencing, or a person living with a mental health condition could be experiencing. And so it informs them about how they make their decisions on a split second. So again, that's kind of where that out of the box thinking came from, and just appreciate you guys so much. Um, yeah, thank you, Janice. And for everyone here, join us December 10th. It's our much anticipated annual event that Janice Black Warner puts on with the City of Beverly Hills. Rosie, if you would like to come, we'd love to have you. And Angela, I think she's scooted off, but she's also welcome to come. It's an in-person event at the City of Beverly Hills City Hall. Special guest star, their mental health dog, NAMI, the dog. And we'll be sharing stories of hope and resilience with our UCLA PFAC. So I'm looking forward to seeing everyone on December 10th.
Thank you. And thank you so much for having us. Angela's computer died, but she let me know to send her love. And again, thank you so much for having us. This was great.